We have various types of hazards. We have the physical hazards, we have the biological hazards, we have the chemical hazards, the ergonomic hazards, and the psychosocial hazards. Let's pay attention to the ergonomic hazards. The chair you sit for life for that 5 years, for that 10 years, for that 15 years before you retire, if it doesn't meet with ergonomic standard, you are dying gradually. It's an occupational health exposure which could expose you to a point that after you've retired, you continue to have a distorted back, sprains, back injury, musculoskeletal injuries, and you're wondering, how did this come? These were because occupational health hazards were not identified, they were not controlled in that workplace you found yourself at that particular time. So at the end of the day, you are exposed to either an acute health effect or a chronic health effect. So this year, the ILO OSH is saying that every organization should be able to identify inherent hazards in their workplace for their workers, and put controls in place so that that worker that is coming to work in that organization that could be exposed to those accidents is aware that they exist, but it's also aware that controls have been put in place for him to be able to work, come back to work, and go back home the same safe and healthy condition he came.